Welcome to Rejuvenate Medical Spa. My name is Sarah. I'll be providing you with your consultation today to go over the treatment options that are available to you. So what brings you in today?
So I'm here today to address the sagging skin around my nose and around my mouth. I don't like how I look tired, often around my eyes, and I have a deep line that goes across my forehead that I'd also like to get rid of.
Those are all things that we can help you with. I'd like to start by addressing the upper third of your face. You had mentioned that you don't like the deep line that goes across your forehead, and this is what we would utilize neuromodulators for. Neuromodulators are Botox and Dysport, and these products are injected into the skin and they stop the muscle contraction from happening. The reason why you get these lines is because of the constant movement of raising your brows. So by using these neuromodulators, we actually stop that muscle contraction from happening and you get a smoothing of that line that's there. We can also treat what's called the glabellar region. We inject the Botox or the Dysport into that area, and again, we're stopping that muscle contraction from happening, and you get a smoothing of the lines that are happening there. And then we can go to the crow's feet. When you go to smile and you start pulling those lines upwards, we can actually decrease that, smooth those lines. I also like to position our neuromodulators as preventative. You're just starting to get fine lines in those areas, and this is a perfect time to start utilizing these things to prevent deeper wrinkles from happening. So now that we've covered the upper third, let's talk about the lower portion of the face. You had pointed out that you're not happy with the indentations or the tired look that you're starting to get around the eye area. What's best there is that we can utilize what's called filler, such as Restylane. And by injecting a little bit of the Restylane around the eye area, we reinflate that area, and it actually makes you look more rested. And then from there we move on to the cheek. Most people who are starting to see in the under eye area that you're getting kind of what we call a deflation, so an indentation, inevitably goes into the cheek area. So by us utilizing filler in the cheeks, we can actually plump your cheeks back up. And when I say plump, it doesn't mean that we're going to give you big, gigantic chipmunk cheeks. It's just reinstalling volume that you used to have. You brought in a picture from when you were in your 20s, and that's what we want to do, is just basically reinstall volume that you had. It's like putting air back in the tire. Okay, and then we move down to the nasolabial region. So this is that area from the nose to the corner of the mouth. And again, we'd be using filler there. We are meant to have indentations in that area, so that's something that you want to understand, but we just want to soften them. So you're starting to get what we would consider parentheses in this area. So by doing filler there, we'll soften that. You need to know that when you go to smile, these will still be there, but at rest they'll be a lot softer. Another area that I would suggest as well is that you're starting to get a little bit of a downturn in the corners of the mouth. And by putting a little bit of filler in these areas, we'll kind of turn the frown upside down, okay? And then the next area I would suggest is the pre-jowl region. We start getting sagging of the jowls in this area here. I always say gravity's not our friend, okay? So by putting a little bit of volume in here, you create more symmetry along your jawline.